welcome to the meeting, this meeting of the Nassau Healthcare Corporation. I'm Richard Kessel, I'm the chairman. First, we'll do a roll call, starting with Dean.
Dean Mahalis is board member.
Lisa Warren, board member. Amy Flores, board member.
Richard Kessel, board member.
Lisa Newland, board member.
Jason Abelard, board member. Rory Lance Smith, board member.
Okay, so we have a quorum. Before we start the meeting, I'd just like to ask everyone to rise to just do the Pledge of Allegiance, which we should do. Okay, Dean, you want to lead it? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, we now have the approval of our June 15th, 2026 meeting minutes. First of all, do I hear a motion to adopt the minutes?
One small correction on item number 1.
Well, let's move it first. Why don't you move it? I'll second it. All right, now, are there any omissions, changes, or additions?
Yes, on number 1, it says call to order. The second line reads Chairman Rabinowitz before the roll call. That's all.
Okay. Even though it's an honor to be called Chairman Rabinowitz, he's a great guy and did a great job here. Are there any other changes, corrections, or additions to the minutes? Okay. All those in favor indicate by saying aye.
Aye.
Aye. Any opposed? Any abstentions? Okay, the minutes carry. I've got some brief remarks. As you probably hear, I do have a little bit of a cough and sore throat, so I won't be lengthy. But I want to just address a couple of things. First of all, I thank all of you for coming here today. And the job that you're all doing in your various departments is terrific. And, I talk to Tom almost daily, and I thank you for all the great work you're doing. Shakira and I are going to sit down in a couple of weeks and talk about the work that our people, the CSEA, do. Great job. They do a great job, and they should be recognized for that, as everyone else is doing, from Tom Stokes down. Just appreciate all the hard work that you're doing. Unfortunately, there's been a lot of press about NUMC recently, and there probably will be more. And we're going to talk about some things later that we want you to be aware of. But I want to make it clear, and this is not being said in a mean way, that this is a new era at NUMC. And we have a new board. We're, here, I'm just here a few weeks, but we're here since June 1st of last year. And there are a lot of changes that we are making, that we have made, and that we will make. But a lot of what's happening here was handed to us, and we inherited by the prior administration. And I just want to indicate that we're going to be transparent in what we do. We're going to take actions, and Tom is going to talk a little bit about the OB department later. We're going to make changes and make decisions that aren't the most popular sometimes, but they're necessary for patient care and patient safety. And they're changes that we have to make. This is tough times right now, all over. And I think that all of these board members and myself understand that we have a responsibility. And, it's an easy thing to sweep it under the rug. Easy to do. And that's how business was done here at NUMC for years. We're not going to do it that way. We're going to take our time. We're going to be patient. But we're going to make changes, some of them major, like the temporary shutting of OB for the second time. And again, Tom will address that. I also want to indicate that I know there was a couple of articles last week about the NHCC Foundation. And I just want to indicate that the foundation operated, again, poorly and by management, and that there were decisions made that shouldn't have been made. And I'm going to propose tonight, later when we come back in from executive session, that we form a committee of board members, and several have volunteered to be on that committee, to investigate the foundation. Obviously, they'll need staff to help them, but also to take a look at, should we have a foundation? If we should, how does it operate? Under what guidelines does it operate? Who's in charge? Who's going to sign a check? There are guidelines and things that the prior administration didn't require. And while I think the foundation could do a lot of good for the hospital, I think it has to be under strict guidelines. And so when we come back, we will be talking about that in terms of forming a committee tonight to do just that. Also, I should indicate that this will be the last meeting of the summer. We won't meet in August, but we will meet in September, and we will meet pretty much monthly and regularly. And you will know in advance when the meetings are. When I went into NIFA, they just had a meeting whenever they wanted to. And we changed that. Same thing here. We'll have a specific schedule of meetings, so you'll know and you'll be able to come. But I want to thank all of you for coming tonight and taking the time out to listen to business of the hospital. With that, I'll introduce our CEO, Tom Stokes.
Thank you, Richie.
Yep.
And so as Richie mentioned, I'm going to share some thoughts on OB. We're going to talk about medical malpractice captive. And I would say if you're looking for truth and transparency, hold on to your seats on this one, because the captive in particular, I think, is going to be eye-opening. But before I get into that, I would be remiss if I didn't highlight some of the achievements over the last few months, which I thought, frankly, was going to be this entire meeting until we had some of these issues pop up. So let me recognize the team and note just a few of these recent accomplishments. So unfortunately, Chris Amoroso couldn't join us tonight, but there is a lot of work underway to drive improvements in quality and patient safety scores. And, you know, you may be looking at some of the issues that we're dealing with in the press and sort of question that, but the fact of the matter is we're going to differentiate very clearly in transparency the work that we're doing that's going to simply change those scores, because it's a lot of groundwork and data and what's included, what's not included, versus what we're doing to drive long-lasting improvement in quality and truly affect the quality of care for our patients. Patient experience scores are trending favorably, as I've seen in the most recent reports. Very exciting time of year in that we have 100 new residents that just started in June, the end of June. Financial progress and gap closing plan is underway. We have bolstered by not only new revenue and cost savings opportunities, but $19 million more in VAPAP funding and $38 million in IGT. Now, the fact of the matter is we're still working on that federal match for the IGT, and we're in conversation with Nassau County to get opioid funding freed up to ultimately provide that match. Language services was relocated to the lobby in a quite prominent space. Thank you, Member Flores, for highlighting that early on for us. We've established that we will be able to provide free patient and visitor parking. More news on that in the month of August. We've opened weekend cafeteria hours. So as we've been talking about, we're a 24/7 operation. When I walked in here on the weekend and saw the cafeteria shut down, I was wondering where people actually went to eat. So that was very much appreciated by the residents in particular. We've had numerous employee engagement and recognition ceremonies, including the Daisy and Iris Awards. For Stroke Awareness Month, our employees, believe it or not, logged 15 million steps. And shout out to PM&R, who won our step challenge. Anyone here for PM&R? Smaller group. Okay. Anyway, we're meeting with them. I believe it's next week. We talked about the need to reinvigorate the Harmony relationship. So our FQHCs that were established a good 15 years ago or so, we've sort of severed that relationship. And in fact, just by standing up the interface, which now we utilize for radiology referrals, and will be expanded to focus on other specialties. Radiology referrals have grown 55% over where we were last year, an amazing achievement. We've had multiple emergency preparedness drills. I'm looking for the emergency preparedness. Yes, Steve. And I saw Mary in here somewhere. Mary, right next to him, of course. So we're really making great progress there, as you heard me say from day one in this place. The safety of our employees and the safety of our patients comes number one, and I think we're doing a phenomenal job there. Incidents of workplace violence have significantly declined. Our cath lab testing, which, believe it or not, the cath lab had been mothballed for about 5 years. The testing has been successful with the fire marshal, and we're awaiting a DOH inspection date. And soon we'll be able to announce the reopening of the cath lab. Our project management office has been stood up to track critical initiatives. Health First representatives are now in our lobby enrolling patients, actually right outside these doors. If for the board members you did not notice that, we're actually off to a solid start with 78 new enrollments in the month of June. Compliance and professionalism work is underway. We have a new executive leadership team in place, and strategic affiliation discussions are underway with some of the most prominent names in healthcare. So just a few of the things that we've been working on over the last few months, and I'm very proud of the work that everybody's been doing, and really just pleased by the progress. So let's talk about some of the OB and medical malpractice business. We'll start with OB. So the headline that we're closing OB indefinitely is probably a little bit strong, probably invoked some emotion, I imagine, as it did with me. The fact of the matter is DOH has given us 60 days to go ahead and correct what we need to correct and reopen. That being said, I'm not sure it's possible to reopen in 60 days at the level of quality that I would expect and others would expect, DOH would expect. So there are preliminary discussions that we're talking with DOH at this point to extend that beyond 60 days if we need to. That would be precedent setting, but DOH understands the importance of getting it right. So more to come there. I also want to confirm that this closure, again, just like the first one, has absolutely nothing to do with the finances. I know that was alluded to in a Newsday article right after the first shutdown, or pause, I should say. This has nothing to do with the finances. So let me get into a little bit. I'm going to share with you a little bit more, frankly, than I have been initially comfortable, but to sort of squelch some of the noise around this particular issue, I felt the need to sort of provide a little bit more. And this is not being transparent. It's adhering to HIPAA laws and making sure that we're not sharing any confidential information. So I've asked Roy to sort of, shut me off if I get a little bit too deep here. And I am going to keep it high level. I mean, there are other folks in this room who've heard far more detail. So the fact of the matter is there are a few things that we need to correct. Yeah, sure. Things like staffing, we do need to correct. There are instances where we have residents sort of, doing their own thing without much supervision. That needs to be changed. The fact of the matter is there are basic protocols that need to be established around standard of care in OB, like the time to get a patient in for an emergency C-section. Shouldn't take 20 minutes or 40 minutes or even 50 minutes as was documented in a medical record. It should be 3 to 5 minutes, should be the standard, as is the case anywhere else. We need protocols in place for when we lose fetal monitoring. And, the fact of the matter is, again, standard of care not being followed. We also need to make sure that there's collaboration amongst our departments, amongst our staff, but amongst our departments. And, when a chair calls another chair when they're in an urgent crisis situation, and the response is, well, don't call me, call the person who's on call, and then the person on call doesn't come in, that's a big problem, okay? So, yes, okay, we have, attending schedules and staffing and other things to worry about, but there are on-the-ground issues that we need to correct as well. And I can tell you that DOH agrees wholeheartedly with us that these things need to be corrected before we can reopen. So I will say, though, in terms of some of the later cases, we have some issues, again, where we had complicating factors. If you all recall, about a month ago, we were allowed to reopen as per DOH as a level 1 OB service. So think about this as, unfortunately, it's a little bit confusing, but it's the opposite of trauma, where a level 1 trauma center is the best. That's what you aspire to be. A level 1 OB is sort of the bottom rung, right? Level 3 is where we were operating before. And what that means is that you need healthy moms, healthy babies, right? 35 years and younger, 36-week plus gestation period, no complications whatsoever. The last case that sort of triggered this particular issue, there were a couple of known complications and protocol wasn't followed. We should have immediately contacted Northwell or another hospital of the patient's choice, and we should have coordinated a transfer. That did not happen. Okay, so there are just some basics that weren't adhered to. And yes, I want to acknowledge, you've heard other people talk about this in the past, that we have much more complex cases seen here at NUMIC. And what you'll see is that this strategic planning process that we're going through with Huron and the data that they've been able to get their hands around as it relates to other hospitals in Nassau County, once we start looking specialty by specialty, department by department, you'll see just how special we are. And I think that'll prove out in the case of why you need NUMIC to stick around and be here for the community. I'll also say as it relates to, and this issue is up for discussion, but as it relates to OB, we also do not have genetic testing here at NUMIC that gets sent out. That's a bit of an exception. So, one of the things that we need to really have an honest discussion about, and I mentioned at the last board meeting where we didn't have press present and that we're going to need to talk about again, is this element of trust and transparency and health equity. And the fact of the matter is the service that I would expect my family to receive or the families where I was previously, or frankly, any of the other local area hospitals, we're not providing in some cases. In some cases, it's a service improvement issue. In other cases, it's a health equity issue, things that we're just not doing that we should be doing if we're providing equitable health care. So all that will, come out, and we'll focus on not only Nassau County, but the metropolitan area as it relates to that health equity and trust issue and just the real truths about what's happening in the healthcare industry today. But that'll wait for a future discussion. Okay, so that's OB. Let's go on to captive. So we have a captive medical malpractice corporation that's set up. It's Cayman Islands domiciled. And it is governed by CIMA, the Cayman Island Monetary Authority. Work was underway at the tail end of 2025 where we hired a third-party administrator to ultimately assess our claims. And as we were doing that, we realized that the hole was a little bit deeper than we expected. And what the typical process is a third-party administrator works with plaintiff attorneys. They work with claims management, which we really didn't have much of here in-house, and then ultimately hands off those data to an actuarial firm, which then comes back with a number that tells you what your overall liability is on these claims. You need to record it in your financial statements. So just a few weeks ago, what ended up happening was we got word back from Oliver Wyman, which is a Marsh subsidiary, telling us that our medical malpractice reserves, and I can get into what all this means, but our reserves were about $105 million underfunded. So we had $105 million in liability that was not showing up on our balance sheet. And the portion of it here in the U.S. for Nassau County Healthcare Corporation was about $45 million, about $60 million for the captive. Let me just take a step back. So a medical malpractice captive, or any insurance company, because that's basically what it is very different from like your car insurance, right? You have car insurance, you pay your premiums each month, you get into an accident, you pay your deductible. Let's say that you have, $20,000 in damage to your car, you have a $1,500 deductible. You pay that $1,500 out of pocket, you have $18,500 in coverage. Ultimately, that takes care of it. That's the end of it. There's nothing more to think about. When you're running an insurance company, you're required to keep reserves for potential payments that may come down the road. Very different. So the way that this captive is set up is we have what's called an insurance tower. So we have a deductible that's paid for by the Nassau Healthcare Corporation here in the U.S. We then have another layer that's paid for by the premiums that are submitted to the captive insurance company. We then have another layer that's paid for, again, by the Nassau Healthcare Corporation here in the US, and then it goes into commercial insurance. So when you think about how all of that was done in the past, it was about $1 million deductible early on for the Nassau Healthcare Corporation. Then it goes up to $12.5 million in coverage from the captive through all the premiums that we pay through the captive, which is about $6 million a year. And then there was another $7.5 million that the Nassau Healthcare Corporation pays called the buffer layer. And then $30 million, believe it or not, in excess coverage beyond that for large claims. So we had three choices when we found out that this liability was $105 million. One, we could have shut down the captive. They would have froze the $35 million that was in there and, probably sanctioned us to pay the rest at some point in time. The other thing is we could have come up with $60 million just to go ahead and fill that gap. Well, clearly that's not happening. We don't have $60 million laying around. Third option was to go ahead and adjust those deductibles, adjust the policies, if you will, and change it so that the liability shifts back to the U.S. and not in the captive. So that's what we were required to do, and that's what the board took action last month to approve me doing, going down to the Cayman Islands, reconvening the first what they refer to as onshore Cayman Islands board meeting for the first time in about 5-6 years. So in doing that, we were able to go ahead and change that deductible from $1 million to $5 million, shift the $60 million in liability. The unfortunate part is all $105 million, and we actually had a $5 million buffer from the captive that came through as well, just to account for that point in time where we were when we actually made the change for 2026, because those numbers that I shared were through 12/31/25. So a total of $110 million. It's all sitting on our books now. So we need to grapple with how it is that we're going to do this. Now, the benefit in this, if there is any, it's a lot of money, but the benefit, as opposed to shelling out $65 million in one shot and then paying these additional claims as we go forward, is that it buys us time, because we don't have to come up with the cash right away to dump into the captive. So being that it's on our books, what we're going through right now, and I'm looking at Samantha, who's actually working with Oliver Wyman to come up with a cash flow projection on all these claims. And it's probably going to be 1.5 to 2 years, maybe even beyond that, that we'll have to pay out this $110 million. So a lot of work has gone into this. A lot of work will continue to go into it. And I'll just say that as it relates to the captive, the next step will be probably starting from scratch, in that we need to reassess whether or not we want to be in the captive business. There are absolute benefits to having a Cayman-based captive, insurance captive for sure. In fact, just on the reinsurance premiums versus the U.S., it's about a 20 to 25% discount from what you would pay if you just went straight out with insurance from the Nassau Healthcare Corporation. And the reserve requirements are usually less than the U.S. But again, let's take a step back. We needed to make sure that, one, our assets weren't frozen, two, the captive was still functioning, and three, we had malpractice coverage, because that would be obviously devastating for this organization if we did not. So, we're going to go back out, and the next step is going to be to assess what the plan is going forward. Certainly, I would say I'm probably being a little bit premature without having discussed this with the board, but I think we need to probably move ahead and move away from Marsh, who was the captive manager, Honigman, who were the lawyers, and Oliver Wyman, who were the actuaries, and maybe even the auditors, Grant Thornton, who were involved in all of this. And frankly, no one spoke up and didn't see anything, even though we had settlements that were being made on cases that weren't on the loss runs that were submitted to the actuary. So there are a lot of moving parts there, and I apologize, this is super confusing. Captive insurance is not an easy topic to grasp, but nonetheless, I just want you to all be clear, just in case you hear the rumors going around, that yes, we do have malpractice coverage, but yes, we also do have another $110 million in liability sitting on our books. Okay, I don't know where that G's came from, but that was perfect timing. With that said, Mr. Chairman, I'll leave it at that and pass it back to you.
Thank you, Tom. Are there any questions from the board to Tom? Okay. Thank you, Tom. I know that the captive issue is very complex. There are a lot of moving parts to it, and for some of us, it's very hard to understand. But the bottom line is, this is an example of kind of discovering this when we took over the management and governance of the hospital. And it's something that is being looked at a number of levels, and you'll hear more about it. With that, let's do committee reports. Finance Committee, July 14th, it met. Oh, are they going to do report? Okay. Oh, okay. There you go. There you go.
Good evening, everyone. I'm Rory Lansman. I chair the Finance Committee. We had a meeting earlier this month. I'm going to give you an update on the unaudited financial results through May of 2026. For May, we recorded an operating loss of $15 million, which is actually almost $1 million favorable to what we had projected, driven primarily by cost savings that offset lower patient volume. Year to date, we've posted an operating gain of $19 million, which is $87 million favorable to budget, meaning better than we projected. That gain, though, comes almost entirely from two one-time state payments of $27.5 million and $57 million in February. One first in January, the second in February. And those volumes are helping us now, but they are not recurring. And so, to a certain extent, they are helping us mask isn't the right word, they're helping us get through some softness in patient volume that I know the management is diligently working to address, and is a topic we've talked about a few times at the board. Specifically, what that means that on revenue, the May inpatient discharges were down about 9%, and emergency room visits were down close to 9%. But those are partly offset by A. Holly Patterson running significantly more patient days than had been anticipated. Some of that has to do with some of the operational and strategic and marketing strategies that have been put in place to, I guess, drum up business for A. Holly Patterson. Additionally, there were certain minor amounts in the low million range, including a one-time $1 million plus tax payment. On the other side of that is that if you have lower volume, you have lower staffing and cost needs, which was $1.5 million favorable to budget in May, and put us at $7 million plus favorable to budget year to date, which is not just a function of lower volume, but also, frankly, better management of our staff and of our team. So on the balance sheet, cash stood at $27.6 million, which is down $7.2 million since December, driven primarily by liability paydowns, including a third January payroll period, growing receivables, and I would note overdue Nassau County Correction Facility payments. The bottom line is that patient volume does remain soft, but one-time state funding has us well ahead of the budget for the year. Obviously, the governor is taking very seriously her commitment to preserving this hospital, and the management team, we're satisfied, is managing expenses as well as they can and working our way through it. That's my report, Mr. Chairman.
Thank you, Rory. Are there any questions on the part of the board? Okay. Thank you. Seeing none, we have the Legal and Audit Committee that met July 14th.
Good afternoon, everyone. Dean Mahals is Chair of the Legal and Audit Committee. There are 4 items I'd like to review. On the meeting of July 14th, 2026, we, number 1, reviewed and accepted the minutes of the previous meeting from May 20th. Secondly, we reviewed several confidential litigation matters in executive session. Thirdly, we reviewed and approved 53 contract resolutions, some of which will be in the packet that we will discuss today. And lastly, we had a presentation at the meeting from our Chief Compliance Officer, Mr. James Saunders, regarding the federal and state exclusion and monitoring policy. And I'd like James to just briefly summarize what that is for the audience. You want the mic? Okay, either way.
Good evening. So, federal and state guidance and Medicaid regulations require that medical providers perform exclusion and sanction screening on a monthly basis. The Medicaid regulations are pretty clear, and I'm happy to say that we are actually performing that job pretty well, with one area that has some concern that has just been brought to our attention. So right now, there's 2 policies in place, and it resides in the medical staff function, where they are screening clinicians who are applying for credentialing and are up for recredentialing every 30 days against the federal sanction list, the state sanction list, as well as the SAM, something called the SAM list, which looks at state grants. So we've developed a corporate level policy that is going to capture HR, procurement, and finance and other areas of the hospital, and ensuring that if we do discover any individuals who have been hired inadvertently, that we will effectively repay the federal or state government any money that they may be due as a result of that hiring of that excluded individual. So,
Thank you, James.
any questions?
Any questions from the board? Mr. Saunders? If not, thank you. That concludes my report.
Thank you. All right, now we've got the Medical and Professional Affairs Committee, which I understand met today. So,
Hi, Lisa.
Lisa,
Yep, Lisa Newland, Chair of Medical and Professional Affairs Committee. We were supposed to meet on July 16th. We did not have a quorum, so we agreed that we would meet today before this meeting. And so in that meeting, we were able to approve the minutes from our May 21st meeting. We also had to approve a revised set of minutes from the December 1st meeting. We had previously reviewed the Leapfrog survey and talked about the Health Equity Initiative within that, but that was discussed in executive session and was not reflected in our minutes, so we needed to correct our minutes for the purpose of showing that. So for today's meeting, we basically were able to look at our credentialing packet, and there were some sensitive matters that we had to address in our executive session, which we did, and that will also follow some of the discussion that this board will have with regard to some staffing issues that need attention. That concludes my report.
thank you. Are there any questions? Okay, thank you, Lisa. Now it's time for a public comment. If you want to speak to the board, just give us your name and where you reside, what town, and where you live here. All right, we'll start. Come on.
I can speak from here.
Okay, great.
I have a good voice. My name is Sharon Jacobs. I live in Montauk, and I was a nurse here. I retired 5 years ago, for 34 years from labor and delivery. So I speak from my own personal professional experience. Closing labor, in my opinion, closing labor and delivery goes beyond the I have insurance, you don't philosophy of the area and what gets portrayed in the outside, or I'm here legally and you are not. This is a public health and safety issue for the pregnant women of this area. East of NUMC, there is no hospital in Nassau County with an OB department. St. Joseph's doesn't have one, Plainview does not have one, Syosset doesn't have one. East of us, the closest is either Huntington without oxygen from the mother to the baby, at 1 minute, fetal brain cells begin to die. Serious fetal brain damage starts to occur by 3 minutes, severe permanent damage after 10 minutes, and fatal or profound long-term neurological complications beyond the 15 to 20-minute points. So somewhere in that travel, that baby becomes damaged or dead. Making ambulances having to pass this hospital to drive further and longer to save these women and their pregnancies is irresponsible, unconscionable, and a major health disservice to the women of this area. Thank you.
All right, who else would like to speak? All right, no one? Okay, thank you. I think you make a lot of very salient, good points. And I think our goal is to try to get that OB department up and running again, but only when it's safe to do so. And I think that Tom and the administration will keep us all updated, because obviously, I think you make some very salient and good points. I also just want to, before I call for executive session, thank the board for all the great work that they did. This board, I think I said it at the last meeting, really laid the groundwork for spectacular work. And you're hiring a new management team. Excellent. Thank you very much, each and every one of you. Sorry. Now we're going to go into executive session to discuss personnel and litigation matters according to Section 105 of the Public Offices Law. Do I hear a motion to go into executive? Amy Flores, is there a second? No? Second. All those in favor? Any opposed? Okay, we'll be back. I'm not going to say soon, but we will be back. Thank you very much.
Actually, that's not a bad. I'll charge that for you.
Reconvene? Okay. Second? Amy, all those in favor? Aye. Okay, we reconvene. So what we're going to do is, Roy is going to go through the litigation, report out that I'm going to propose two resolutions that we can vote on, and I think that's it, right? Okay, Roy?
Okay, so first order of business is to report things that have to be reported out from executive session. First of all, we deliberated and made settlement recommendations on a number of litigations involving Nassau Healthcare Corporation in executive session. And we also voted to approve the policy entitled NHCC Federal and State Exclusion Screening and Monitoring. That's a new policy that was recommended by compliance. It was adopted after a presentation by compliance. So those are the two things there. Then I will proceed immediately into the resolutions on contract approval. That is in your packet. We're going to do it in 3 different groups because several board members have to recuse themselves from certain issues. So the first one will be for all contracts listed in the packet, except for a contract involving Arthrex and Entellus. So for everyone, so there is no recusals on that, so because it's every contract except the one involving Arthrex and Entellus. So would entertain I turn it over to the chairman to make a resolution to approve all contracts, but the contracts involving Arthrex and Entellus.
So moved.
Okay, does anyone, do we have a second? Okay, does anybody vote in the affirmative? Do we have
Yes. Aye.
anyone vote in the
One
negative?
vote? Any abstentions? Any noes? Passes.
Okay, then we're going to take a motion to vote. We're going to move to approve the Arthrex contractual relationship Actually, Mr. Abelov had to recuse himself from that, so since he's not here, can we entertain a motion to approve the Arthrex contract?
I'll second it. All those in favor? Aye. Any opposed? Any abstentions?
And then we need a motion to approve the Intellis contract. Mr. Mahalsis is excused for that one. Do you have one?
So, wait, does Jason need to come back now that we voted on his?
Well, he's not here. I think he just wasn't here generally, right?
Because if
Oh, he had to leave.
recusing himself, then we don't have a quorum, right?
1, 2, 3. Well, we have 5. 5 should be. His recusal doesn't affect the quorum, right?
Yeah.
Yeah, all right. So with respect to the approval of the Intellis contract, do we have a motion? Second?
Second. Lisa seconds it.
Okay, all those in
All
favor?
those in favor?
Aye.
Any opposed? Any abstentions? Okay.
Okay, with that approval, that is all I have.
Okay, thank
Wait,
you,
we
Roy.
have an
abstention, is it not?
Abstention.
It's a recusal or an abstention, that's fine. We will record it as a recusal.
Just abstain, yeah.
Yeah, that's fine, okay.
Okay, I've got 2 resolutions regarding 2 committees. First, I make a motion that we establish A. Holly Patterson Long-Term Care Committee with Lisa Warren as chair and members Amy Flores and Dean. And Lisa, do you want to just quick what this is going to do, or?
I will have information for everybody when my role,
Okay,
when I come back to the next.
okay.
So,
So I make that motion. Is there a second?
Second?
Okay, Lisa, all those in favor?
Aye.
Any opposed? Any abstentions? All right, finally, I propose to form a committee to look into the Nassau Healthcare Corporation's foundation. And this is something that follows some critical reviews of it. I think what we want to try to do is find out, for A, should we have a foundation? And if so, what's its mission? And what are the guidelines? How does it operate? What are the guidelines in terms of what it does, who it takes contributions from, and how the foundation itself is administered? So I make that motion. Is there a second? Aye. Okay. All those in favor? Aye. Any opposed?
Did you just say who's chairing? Did you say who's chairing?
Amy,
no, I'm not sure.
not Amy, Lisa is going to chair, and Dean and Lisa Newland are going to be on the committee. And hopefully that committee will report back to the board by the end of the year.
Yes.
That's important. Okay, so we voted on all that. Do we have anything else? We have anything on the credentials, Tom?
Yeah, the credential packet.
So I'll take the credential packet is in your materials. I will I guess someone can make a motion to approve.
I'll move to accept the credentialing packet as provided.
I'll second it. All those in favor indicate by saying aye.
Aye.
Aye. Any opposed? Any abstentions? Okay. We don't have anything else, right? Just to announce, the next meeting of the board is October 1st. And following that, we also chose as the following meeting, October 27th. So the next 2 meetings will be October 1st and October 27th. Do I hear a motion to adjourn?
I'll make a motion.
Okay.
I'll second it.
Lisa seconded. All those in favor? Aye. Any opposed? Any abstentions? By the way, question to ask yourself, what if we voted down the motion to adjourn?
To adjourn? We leave anyway.
Okay. I'll accept that. Thank you. Have a good night.
The lot was, the reserve lot was